My name is Patty Porter, and I'm the Director of Marketing here at Santa Clara Valley Medical Center Hospital and Clinics. It gives me great pride to welcome you today to the County of Santa Clara Health System. Over the next 25 minutes, I will be giving you a presentation that gives you an overview of the health system and a little bit of background about Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Hospital. At the County of Santa Clara Health System, our values are to provide excellent and compassionate care in a respectful manner to everyone we serve. This includes patients, families, friends, visitors, and one another. We demonstrate integrity by being open, honest, reliable, and transparent through our actions and through our words. We're respectful of the individuals we work with and the people we serve. This includes everyone in the communities of Santa Clara County. As an organization, we value learning and we strive for continual improvement based on what we learn. In our setting, that plays out by not only teaching healthcare professionals, which I'll speak to in a moment, it also speaks to our individual and collective efforts to continuously improve the safety, quality, experience, and outcomes associated with the care that we deliver. We are wholly accountable for our performance, decisions, and actions, not only to the communities we serve, the taxpayers, and the Board of Supervisors. And we strive for excellence in everything we do. By way of organization, the head of the County of Santa Clara is a very nice gentleman named Dr. Jeff Smith. He is the county executive. He reports directly up to the Board of Supervisors. Under Dr. Smith is a number of departments. There are actually 28 departments in the County of Santa Clara. Among them is the healthcare delivery system. In our setting, we are called the County of Santa Clara Health System, and our director is Mr. Rene Santiago. You can see our logo to the right of his name. Reporting directly to Mr. Santiago are a number of divisions that all work together to improve the health of the communities we serve. The hospitals and clinics are overseen by Mr. Paul Lorenz. This now includes O'Connor Hospital, St. Louis Regional Hospital, and Santa Clara Valley Medical Center Hospital and Clinics. Behavioral Health under the direction of Tony Toles, Valley Health Plan under the direction of Mr. Bruce Butler, Custody Health under the direction of Matt Guerriere, Public Health Department under the direction of Sarah Cody, and Emergency Medical Services under the direction of Jackie Laufer. The Emergency Medical Services Agency is responsible for all the pre-hospital care that's delivered in our county. They also do a lot of community education, including community CPR trainings. They do disaster response training, and very interesting, they're responsible for the deployment of automatic external defibrillators, which are devices that are deployed in our community that are available to the public in the event a patient or a person goes down and they are pulseless. These high-tech defibrillators are able to shock a person's heart back into beating, which has been proven time and time again to improve the mortality and the morbidity, people's ability to survive a sudden cardiac arrest. Also, under this umbrella is the Public Health Department, which really focuses their work on improving the health of communities through education and promotion of healthy lifestyles, disease and injury prevention. They are very, very involved in our communities, and they will be involved with you as healthcare professionals within the county to work together to promote sound, healthy policy, to do things such as make sure that all of our committee members are educated about the importance of flu vaccine, to educate the public about healthy lifestyles, and other things like promoting the vaccination of flus for the flu season every year. Valley Health Plan is the only locally based commercial health plan in Santa Clara County. VHP provides the most affordable managed care products available in the marketplace to purchasers and consumers across a wide spectrum of categories, including commercial, Medicare, Medi-Cal, and workers' compensation. Valley Health Plan is one of the options you will have as a new employee to the county. I encourage you to look closely at this health plan. It has a wonderful offering in terms of benefits and access to high-quality healthcare providers around the county of Santa Clara. The The Behavioral Health Services Department provides mental health and substance abuse programs and services, including a call center, emergency services, inpatient services, outpatient services, substance abuse use services, and suicide prevention, and crisis services. Custody Health Services Department provides programs and services to individuals who are incarcerated in our county, specifically in the Santa Clara main jail, which is located downtown, the Elmwood jail, the Elmwood Correctional Facility, which is located in Milpitas, and the Juvenile Hall locations throughout the county. Santa Clara Valley Medical Center is a large health system. Our mission is to provide high-quality, compassionate, and accessible care for everyone in Santa Clara County, regardless of their ability to pay. We are the fourth largest public hospital system in the United States. We've been serving the public for more than 140 years, with our very early beginnings actually in 1851, when the city of San Jose became the first capital of the state of California in the year that it was established. In fact, our very early beginnings include the 10 infirmary beds that were associated with the state capitol in downtown San Jose. The current site of Santa Clara Valley Medical Center was established in 1871, and the hospital was built and completed in 1876. We have been here humbly serving everyone in Santa Clara County since then. Santa Clara Valley Medical Center is very, very proud of our commitment to research, with over 100 research projects ongoing on our campus at any given time. This is in addition to the amazing research that's going on in our Rehabilitation Research Center. We have a long-standing history and commitment to the use of innovation and technology to optimize patient care, to minimize risks, and to improve the health of our population. Last year, we were the very proud recipients of the HIMSS Stage 7 designation, which basically represents that our organization is virtually paperless. We are one of less than 4.5 public hospitals nationwide to achieve this level of integration. In 2017, we were the first hospital in the world to deliver 20 million stem cells to the spine of an injured patient. The Sobrado Pavilion is another example of our commitment to innovation and technology. This beautiful new facility, opened in December of 2017, features 168 private rooms. Beautiful, spacious, designed by caregivers who work in our hospital. Nurses and doctors and therapists got together to design the rooms to make sure that the patient was the center of care. From floor to ceiling, these rooms are packed with innovation, and for my colleagues in the room who are healthcare providers, I think you can appreciate the fact that all of our ICU rooms in this facility are plumbed for dialysis. Amazing. Another fact is that here at Santa Clara Valley Medical Center, we are one of only 10 facilities in the country that offers endoscopic ultrasound-guided liver biopsy procedure, which improves the efficacy, the accuracy of liver biopsies for individuals who have elevated liver enzymes and for whom an accurate diagnosis is needed. I'm very proud to share that Santa Clara Valley Medical Center Hospital and Clinics are the recipients of numerous quality awards and certifications over its many years here in the County of Santa Clara. We are a tertiary level acute care medical center accredited by the Joint Commission. Among our many accreditations and certifications from the Joint Commission are our sepsis certification, which speaks to our commitment to high quality care in the prevention of infection and the proper management of infection for individuals at risk for sepsis. We're also a certified primary stroke center, among many certifications we hold with the Joint Commission. We are the only American College of Surgeons verified Level 1 adult trauma center in San Jose, and we are the only Level 2 pediatric trauma center also in San Jose. We are one of 2 trauma centers in the County of Santa Clara. In order to be recognized by the ACS as a trauma center, not only are you required to have emergency services available, such as the helicopter that flies in and lands on top of our emergency room, and conveniently accessible services, we also have to have 24/7 specialists available to treat patients as they come into our emergency room immediately. This includes the availability of specialists technicians, equipment, etc., that allows us to provide care for individuals, especially those with life-threatening trauma. In order to be in a verified trauma center, you also need to provide outreach to the community, educating individuals about those things that put them at risk for trauma, as well as doing research on trauma-related activities, such as in June every year when our weather heats up, we unfortunately see a number of individuals who fall out of windows, toddlers namely, and so we need to go back to the community every year to remind them as the weather heats up that they need to move their furniture away from the window to make sure that their little ones aren't the victims of this unfortunate traumatic event. We are very proud of our CARF accreditation, which is the highest level of accreditation available to a rehabilitation service. We are CARF accredited for both our inpatient and outpatient rehabilitation services. We have the only respiratory rehabilitation unit on the West Coast, one of only two in the country. In this unit, patients come in, they're admitted previously being what would be considered ventilator dependent. And while not everyone who is ventilator dependent can be weaned from a ventilator, many patients who previously were not able to be weaned at other facilities are able to be removed from those ventilators and breathe on their own. A very complicated and level of expertise that's required and delivered compassionately by our individuals working in this unit. Very proud to share with you that this past year, our rehabilitation center was recognized as the only high-performing rehabilitation center in the state of California. We rank 15th nationally, and our amazing team of specialists in the rehabilitation center are on the climb, with ranking at number 17 the year before. We are the only American College of Surgeons verified burn trauma care center in the Bay Area, with the next closest trauma center located up at UC Davis, and to our south is Fresno. Our very talented group of burn trauma care center team members provide excellent care not only to children but also to adults who suffered a burn. Our Women's and Children's Center tout some very, very impressive health outcomes for mothers and babies, one of the lowest VBAC rates in the state of California, and recently being certified as baby friendly, which speaks to our commitment to breastfeeding for children, for newborns, which has been shown time and time again to improve their health and growth, especially in the early years of their life. We are a regionally designated high-risk neonatal intensive care unit with lots of research going on in this unit. Many hospitals around the Bay Area will transport their young babies to us, their newborns, especially those who are complicated, those being delivered as early as 23 weeks and about less than a pound in your hand. Are very compassionate and skilled individuals who work in our NICU, help these babies and their families to grow and develop and to such a point in time when they can be discharged home to their families. We offer acute and inpatient psychiatric services at Santa Clara Valley Medical Center. We are the future site of an adolescent psychiatric hospital, and so much more. At Santa Clara Valley Medical Center, we serve over 275,000 individuals every year. Over 25,000 patients are admitted to our very busy medical center. Our labor and delivery unit is very busy with over 3,200 deliveries per year in years past, delivering as many as 6,000 new babies. Our 12 operating rooms are very, very busy every day of the week, with over 10,000 surgeries being performed per year. Between our emergency room, our urgent care, and our outpatient clinics, our clinicians see over 800,000 visits every year. Our operating budget, now over $2.3 billion with the addition of our two new hospital partners. We now have over 10,000 FTEs among the three hospitals, with FTEs specific to Santa Clara Valley Medical Center, roughly about 8,000 employees. Here at Santa Clara Valley Medical Center, we have over 500 volunteers who help us with the patient care experience, and over 150 languages are spoken on our campus by a very talented group of language services experts and professionals. We have a Valley Connection group, which is our call center, who provide care and who provide advice and appointments to patients to improve their access to healthcare services. We also have 10 conveniently located community-based health centers around the county of Santa Clara. To the farthest northwest is our beautiful Sunnyvale Valley Health Center Sunnyvale, located off of Fair Oaks and El Camino. To our very far northeast is our beautiful Valley Health Center Milpitas. To the south is the conveniently accessible and beautiful Valley Health Center Gilroy. We also have health centers in East County, Valley Health Center East Valley off of McKee off of 680, and a beautiful new facility downtown, Valley Health Center Downtown off of Santa Clara Street. Our facilities all offer primary care and family medicine, OBGYN, women's care, as well as pediatrics. All of them have pharmacy services on-site, a laboratory on-site, and radiology services conveniently available for all of our patients. Many of these health centers offer dental care, many of them offer urgent care, and all of them feature a new model in healthcare, which is integrating behavioral health with primary care. So what does that mean? All of our health centers have a licensed medical social worker or a behavioral health specialist who works alongside our primary care clinicians to make sure that individuals who have been diagnosed or who may be suffering from a mental health disorder or need a behavioral health professional's care are seen immediately on that same day. So a very nice warm handoff, making sure we are caring for the whole individual. Two other health centers listed on this include Valley Health Center Lenson, which is our healthcare facility which provides TB care. It has an infectious diseases clinic, and it also is the home to our refugee clinic, which offers healthcare services to individuals new to the country, new to California, who are refugees of other countries needing primary care. At Valley Health Center Alexian is the home of Valley Homeless Healthcare Program, where we provide primary care to individuals experiencing homelessness, including but not limited to a special clinic there for individuals experiencing homelessness who need care in a gender health center. Here on the main campus is our beautiful Valley Specialty Center, which is the home of Sobrato Cancer Center. Very high tech, very high quality. We have our own linear accelerator, which represents the cutting edge of cancer care. We have a renal care center here, cardiovascular care, a number of other specialties and centers of excellence. We have a sleep clinic. We have genetic testing, diabetes management, an amazing GI suite. We also offer services for a number of other medical and surgical specialties. One thing that's important for you to know is that our specialists in our hospital work carefully and closely with members of our community. An example of that is our relationship with the Clean Slate program. This is a very unique relationship between the County of Santa Clara Valley Medical Center, and the San Jose Mayor's Gang Violence Prevention Task Force. Here at our specialty center, individuals who have been previously involved in gang violence and received a tattoo as part of the marking or branding of that experience, who are trying to get out of that cycle of violence and need their tattoos removed, go through a program with the Gang Prevention Task Force. And if qualified and committed to leaving that cycle of violence, they are eligible to participate in a tattoo removal program. It takes as many or more of 22 different treatments to remove tattoos. I'm very proud to share with you that this service is available to individuals from 14 to 24 years of age, and the physicians who provide this very specialized procedure do this for free. Yes, they are volunteers providing this very important services to members of our community. At other locations, we have a geriatrics clinic, we have a wound clinic. With a tremendous effort going on here with the treatment of pain management, with addressing the opioid addiction. We have a gender health center located at Valley Health Center downtown, offering services to the transgender, LGBTQ community and other people who are gender diverse. We are the home of the county's sexual assault response team, which processes any male or female who's been the victim of a rape. We also have a program at our Valley Health Center downtown location which supports the individuals, youth who have been the victims of abuse. We also have a maternal fetal medicine, allergy clinics, etc. available all under the umbrella of specialty care. Another unique program at Santa Clara Valley Medical Center is our Valley Homeless Healthcare Program, internationally recognized for its innovative approach to providing health care in the community for individuals who are experiencing homelessness. We deliver health care in a home shelter clinic at Home First, which is located off of Orchard Street downtown. We have a clinic at Alexian, as I mentioned a moment ago, which offers primary care and gender health services. We have a backpack homeless health care program, which is a team of very, very compassionate individuals who go into the community literally with backpacks on and provide health care services to individuals around the county who are experiencing homelessness, and their health is so poor that they're not able to make it or to get transportation to one of our locations. Downtown, we also have the Bill Wilson Drop-In Center, which is a special health center for individuals in the county who are experiencing homelessness. This center provides a lot of care for runaways in the community from the age of 14 to 24. A very important service to provide, especially in our county, with so many individuals who are this age for whom they're experiencing homelessness. Services for the homeless program are also delivered via mobile health units or mobile medical units, such as the one you see in this picture. We have 3 different mobile medical units. One of them delivers healthcare services through reentry clinics. These are mobile medical units that are parked outside of the reentry facilities, the correctional facility and the main jail downtown. So when individuals are released from incarceration, we make sure they have the medications and health care equipment that they need to transition out of incarceration and back into the community. We also have a Valley Teen Van, which provides healthcare services on a rotating basis to the 26 alternative high schools located around the county of Santa Clara. These young individuals otherwise would not have healthcare services available to them, so this mobile unit basically acts as a school health clinic for young people in our community. The mobile medical unit you see pictured here actually goes around the community to various encampments and areas where there are large numbers of people who are experiencing homelessness. They go all the way up to Sunnyvale, they go down to Gilroy, they go to the migrant farm camps across the county, all providing healthcare services to individuals experiencing homelessness. Our Valley Homeless Healthcare Program also offers dental health for individuals who are experiencing homelessness. This slide is just meant to, again, illustrate the fact that Santa Clara Valley Medical Center is an integrated delivery network, including hospitals, clinics, our affiliations with other community health providers in the community, other facilities, including behavioral health and community health centers. We have a tremendous and long-standing history to teaching, with 1 in 4 doctors in the county of Santa Clara receiving training at Santa Clara Valley Medical Center. We're very proud of our ACGME accredited residency programs in internal medicine, OBGYN, radiology, and transitional medicine. Santa Clara Valley Medical Center hosts over 200 Stanford medical students and Dartmouth University medical students on our campus every year. Those medical students rotate through our facilities in internal medicine, emergency medicine, surgery, pediatrics, etc. Very proud to share with you, year after year, we are the recipients of teaching awards from Stanford School of Medicine. What does that mean? At the end of their training year, every year, Stanford medical students are asked to rate their experience at any of their 6 training facilities, of which Santa Clara Valley Medical Center is one. Year after year, not only is Santa Clara Valley Medical Center recognized as their favorite training location, but many of our faculty are recipients of teaching awards. Their favorite attending, and attending is a doctor who teaches a doctor. I'm very proud to work among physicians who are so dedicated to teaching and training future healthcare professionals here at Santa Clara Valley Medical Center. At Santa Clara Valley Medical Center, we also teach nurses, doctors, medical assistants, researchers, physical therapists, phlebotomists, etc. We are a learning organization, very proud of our long-standing history. My colleague Patty Beebe is personally responsible for the training of over 1,000 RN students who rely on Santa Clara Valley Medical Center every year for their training experience and preparation to become a registered nurse. We have our North Star we refer to as our operational strategic priorities. At the top is patient experience. This is very important to us since the Affordable Care Act, as many as 95% of the individuals in our county have a choice, and we want them to choose us. We do a lot of work here to make sure we're doing everything possible to make sure that all of our patients, visitors, and families have an exceptional experience. Care coordination is another one of our priorities, making sure that individuals who receive care receive the right care at the right time at the right place. Very, very important as patients move through here, move through our system, through primary care, and through the hospital programs, given sometimes those transitions can be very complicated. Our county is very dedicated to the identification, recruitment, and retention of exceptional individuals committed to healthcare delivery. We have a lot of programs and opportunities for individuals to spend their entire career here at Santa Clara Valley Medical Center. Opportunities for upward mobility, training, and experience. Many of my colleagues have been here for more than 20 years. Spending their entire professional career here is a real asset to this organization. Another priority is value and cost effectiveness. We are stewards, responsible stewards of the resources we are given by the County of Santa Clara to provide care to individuals in our community. That means that whenever we make a decision about the allocation and use of resources, we must be mindful, making sure that we are making the best decisions, informed decisions about the value and cost effectiveness of everything that we do. Access and capacity is very important in a busy medical center and health system, where we want to make sure that people have timely access to our excellent emergency care services, urgent care, and primary care, as well as specialty care. We don't want our patients to wait to receive care, and we're constantly working on ways to improve that workflow and access to health care. And quality and safety is also a very important strategic priority, making sure that our patients have high quality, safe, and reliable care. At the center of this diagram, of course, are the patient, always the very, very focus of everything we do with our care and services. A little bit about O'Connor Hospital, one of the two new partners we're excited to join, established in 1889, almost as long as Santa Clara Valley Medical Center. Also accredited by the Joint Commission, a primary stroke center, also recognized for their expertise by the American Heart Association. They are recognized by the Joint Commission for their excellent hip and knee replacement programs and services, as well as special certification and recognition by the Blue Cross Blue Shield Association. They're accredited by the Joint Commission for excellent wound care, as well as recognized as a chest pain center, which speaks to their excellence in the timely care of individuals who are at risk or maybe having a heart attack. They are recognized by the American College of Surgeons as a cancer care program. They too are community NICU, a community level 3 NICU with excellent care for newborns coming too early or for whom their delivery into this world was complicated. Our partners at O'Connor are recognized by the American Association of Cardiovascular and Pulmonary Rehab for their excellent cardiology and their exceptional cardiac rehabilitation services. They also provide maternal child health services with a long-standing history of excellent delivery for new moms. They have a widely recognized orthopedics and joint replacement program, and also have special certification by the Blue Cross Blue Shield Association. Recognized around the community for their excellence in sports therapy, spine care, and pain management. They are certified for their hyperbaric care services, and they also have their own family residency program, which is wonderful. We know that our partners at O'Connor Hospital, like us, are very dedicated to training future healthcare providers, physicians who are moving into family medicine as an area of specialty care. Our other new partner in the delivery of healthcare in Santa Clara County is St. Louis Regional Hospital, located in the southern part of our community in Gilroy. Established in 1999, the St. Louis Regional Hospital is accredited by the Joint Commission, also designated as a primary stroke center. They have excellent women and maternal care, baby-friendly certified, which again speaks to their expertise and commitment to making sure that mothers are equipped to breastfeed and provide excellent health outcomes and early development for children through breastfeeding. They also have a breast care center, a very busy emergency service line with CalStar 2 emergency helicopter conveniently located immediately adjacent to their emergency room for rapid transport. They feature an imaging center and have several surgery and surgery specialty procedures available for members in their community. Affiliated with St. Louis Hospital is the DePaul Health Center located in Morgan Hill. It too is accredited by the Joint Commission for Services. They have a very busy urgent care and a fairly new breast care and imaging service line there. Here at St. Louis Regional Hospital, DePaul Health Center, again in Morgan Hill. A comparison or a side-by-side view of the new hospital system is not meant to represent any individual contribution these hospitals make to the care of people in our community. This really is intended to show you and demonstrate the total impact that our larger healthcare delivery system will have to overall access to high-quality, accessible, compassionate, excellent care to everyone in the community. Between the three hospitals, we will have over 1,000 beds. We will be providing in the next year almost 200,000 patient days. Our average daily census between the three hospitals, roughly a little over 500 patients in our beds. Over 5,000 babies will be born to our health system, about 170,000 visits to our very busy emergency rooms, and a staff head count of well over 8,000 individuals employed. When you add up the additional staff that work in the ambulatory care and the specialty care service lines for the entire system, we now have a staff head count of well over 10,000 strong. Again, I welcome you to the County of Santa Clara Health System. When we began looking at the archives, we quickly realized that our hospitals are very, very similar. We look back into the archive.org view of historical websites, noting that pre-Verity, both O'Connor Hospital and St. Louis Regional Hospital both had mission statements very similar to ours. Using such statements as committed to serving the sick and poor, providing excellent, compassionate care and attention to the whole person are something that are very, very similar between the healthcare providers at all three of our hospitals. I encourage you to please be patient with us as we transition through this integration process. We are very confident that with your partnership, we can provide excellent, accessible, compassionate care to even more individuals in the County of Santa Clara. Again, on behalf of the County of Santa Clara Health System, I want to welcome you. For more information about Santa Clara Valley Medical Center Hospital and Clinics, please go to our website, scvmc.org. Thank you.